Ash Ketchum, Pikachu, thanks so much for joining us on the show.
Hey, glad to be here.
Do you mind sharing how you became interested in the topic of asthma?
Well, we were in a battle with Weezing.
Weezing, get that Pikachu! That was a lucky shot!
So you're wondering if Weezing has asthma.
Yeah, I knew it came with asthma.
Didn't you just knock him out by electrocution?
You teach me and I'll teach you medicine.
Alright, well let's start with some human anatomy and physiology. I say human because I don't understand how Pokemon exist, and none of this may apply at all to Weezing.
Got it.
So first let's start with the lungs. Air goes in the trachea, down to the bronchi, and then splits off into the bronchioles.
And what are the little red thingies?
So those are little air sacs called alveoli. Next to them are the smallest of the blood vessels, capillaries. The oxygen comes across to the blood capillaries and we breathe out carbon dioxide.
What happens in asthma?
So in asthma, the airways become reactive, which causes narrowing of the bronchioles. They also have more mucus, which makes it harder to breathe.
What do they become reactive?
People become sensitive to certain pollens, animals, irritants that cause them to be inflamed. Asthma is more common in people with a history of allergies and eczema. Getting a good history is an important place to start. How often you have episodes, their intensity, they wake you up at night, and history of allergens, pets, or triggers.
What do they sound like?
Well, usually on physical exam you hear wheezing.
So he does have it.
Possibly. Yes, I would say in the majority of cases the diagnosis of asthma is made on history and physical, but we also might do some lung testing.
What kind of lung testing?
This is called spirometry, or pulmonary function tests. We have you breathe in as hard as you can and breathe out as hard as you can, and basically calculate different parameters that help to determine if you have different types of lung disease.
So how do you treat asthma?
Well, it depends on how severe your symptoms are. We typically step up or down therapy depending on how often you're having symptoms.
What's step one?
Step one is a medication called albuterol. This is a short-acting beta agonist, or a SABA. This is often referred to as a rescue inhaler. The next few steps are about adding a long-acting beta agonist, or a LABA, in addition to an inhaled corticosteroid, or an ICS, and increasing the dose if that's not working.
Are these inhalers too?
Yes, these are your controllers and preventers.
Are there other steps?
Yes, if those aren't working, then there's other medications we can add on, but we want to really make sure that we're using the medicine as best we can. For example, using a spacer is an important way to make sure all the medication is getting into the lungs. Certain environmental triggers can cause asthma attacks. Another big one is pets.
What are those?
Asthma attacks? These are when symptoms are severe enough and aren't improved with the rescue inhaler. However, one important thing, guidelines have changed a little bit since studies have shown that using your preventer or your ICS LABA medication is also safe and effective in preventing hospitalizations. However, if it's getting hard to breathe despite using your inhalers, let your primary provider know right away.
When I said what are those, I meant pets. What are pets?
You know, a creature for companionship, enjoyment, and training.
I don't think that's a thing in our culture.
Oh, my bad.
Gotta learn it all. Medicine.